Recently, my best friend told me that she had ordered one of those at-home genetic test kits so that she could learn more about her ancestry and health risks. But when she got the results back, she became really nervous to learn that she was genetically predisposed to getting diabetes, according to this test. Typically, at-home genetic test kits use saliva or a blood sample that is sent out to a private laboratory for evaluation. Your DNA is extracted from this sample and tested for a limited number of specific genes that may be related to ancestry or health risks. When learning how specific genes develop from our parents, it's important to understand the basic steps of inheritance. Chromosomes are thread-like structures that are located within the nucleus of all animal cells and consist of coding instructions called DNA, or deoxyribonucleic acid. These are the building blocks of DNA, and they're called nucleotides. Genes are sequences of those nucleotides located on a specific area of the chromosome called a locus. That locus has a function, whether it be hair color, skin color, height, or protein expression. The locus function and location are the same on each chromosome transmitted from both parents. At the locus, however, the nucleotide base pairs can vary, and these base pair variations are called alleles. All traits that make us who we are, today, and give us our unique features, are based off of pairs of alleles within our DNA. And people who are born with the genetic traits for diabetes may be predisposed to developing this disorder at some point in their life. Genetically predisposed people may have normal blood sugar levels, but many will have other markers of insulin resistance, such as electrolyte triglycerides and hypertension. Environmental factors that can be problematic for people who are predisposed to diabetes are weight gain, lack of physical activity, or even pregnancy. A combination of these factors can lead a person to have an increased likelihood of developing diabetes over their lifetime. Genetic tests do have the ability to diagnose most forms of monogenic diabetes, which is caused by a change or mutation in a single gene. Anyone can have monogenic diabetes, but is most commonly diagnosed in infants who develop diabetes before they reach the age of 6 months, teens, and young adults. The tricky part is that most health conditions are influenced by more than one gene, so they're pretty hard to predict outright. And each of these genes can have thousands of variations from one another. So at home, genetic tests currently only look at some of the known genes and variants that scientists have discovered. So not all of them are known yet. Unfortunately, at this time, there is no one test that offers a truly comprehensive health risk assessment. And so it's incorrect to conclude that if you are genetically predisposed to getting diabetes, then this will most definitely happen to you. Buyer beware that most of the direct-to-consumer genetic testing companies out there are not even regulated by the United States Food and Drug Administration. So why was that, you may ask? The accuracy of these tests is actually unknown. So test results received from one company are just one company's opinion of what your DNA results conclude according to them. Test results of the same test performed at one laboratory may entirely conflict with the results received from another company, as each conduct their own tests differently. Who's to say whose test is right and whose is wrong? Who can be trusted to tell us our genetic truth, really? It can be quite a shock to find out that your genes show that you have a predisposition to any disease. Almost like this test is a kind of crystal ball which can predict our future and bring us closer to our ancestral path. After my friend showed me her test results, I told her not to worry so much, because this test is only looking at one aspect of the multiple contributing factors that can influence our development of specific disease in the future. Of course, there are certain contributing factors that are unchangeable, which include our age, our ethnicity, our family medical history. On the other hand, you may be able to avoid some of the environmental risk factors, such as limiting sugary foods in your diet, maintaining a healthy weight, and being physically active. By acting on the contributing factors you do have control over, you may be able to delay or even prevent the development of diabetes altogether. I hope this has given you a little more clarity on the dangers of solely relying on genetic test results to foretell the fate of your health. Although genes can considerably influence a person's health, they are but one piece of a puzzle that can put someone on the road to disease progression. Other factors such as diet, exercise, and family medical history are equally as important in predicting the likelihood of developing diabetes. If you have ever taken a genetic test or plan to in the future, take the results you receive with a grain of salt as an interesting perspective that is not entirely definitive of your overall health outcomes. Thank you.